Hi, welcome back. I'm Dr. Sridhar. Just a quick update about the recent sad incident, the cough syrup related deaths in India. The number of deaths has unfortunately gone up to 21, and in a good turn, the manager, the owner of the pharmaceutical company, Mr. Ranganathan, has been arrested in Chennai. So most of us had expressed surprise that the doctor was arrested on the first day of the event, which was apparently like a scapegoating event. The doctors do need to take care when they prescribe medication, but at the same time they cannot be aware of what is in the pharmaceutical stage, the preparation stage. Going for reputed brands is fine, or we prescribe the generics and the pharmaceutical gives the brand according to the patient's choice. The cost obviously goes up with the branded products, and so generic prescription has two advantages. One is you are not responsible for what is dispensed, and the cost implications are not blamed on you. If you prescribe something more expensive, the patient may blame you. So it's safer to prescribe brands that we are familiar with. And this kind of contamination happens when the quality control regulation in the pharmaceutical industry is not happening properly and the checks are not in place. I mentioned in the earlier video that the owner of the pharmaceutical company has to employ the people who are familiar with the system, with the dangers of contamination, and they take no shortcuts. So it's irrespective of whether Mr. Ranganathan is guilty directly or not, or he advised his staff to take these measures. He's vicariously responsible for the team selection and the actions behind his back. So it's possible this medicine has been available for a long time and has been used, but it's just one incident like this, a contamination that breaks the reputation of a company. So obviously, just to clarify that the doctor who is prescribing the medicine only has responsibility for the indication, whether it's a suitable dose, appropriate route, and whether there was any drug interaction that could happen. Most of us working in bigger hospitals have a good pharmacy team who tracks this and gets back to us, and we have something called medication reconciliations. If a patient is admitted, we need to look at what they're on already and make sure that the drugs we prescribe are not interacting with any of the medications they're already on, and also clarify to the team which medication needs to be continued and which can be stopped. So these are steps which will prevent medication errors, drug interaction, and so on. But ultimately, a doctor cannot be responsible for something that happens at the pharmaceutical level. The preparation of the medication that he's prescribing is not in his hands. There is no way he can check. So the doctor getting arrested in this case is obviously not the right first step. Unfortunately, it has sent a wrong message. In terms of my request to the medical fraternity, kindly consider every symptomatic treatment as optional and make sure the patient understands that it is an optional treatment, that the symptoms will get better with time. The specific treatments that are essential to treat, again, use rational thinking, whether the antibiotic is needed for a particular indication, whether any other specific treatment is needed. There will always be a diversity of views in regards to treatment. For example, some colleagues use diuretics for bronchopulmonary dysplasia. I personally don't believe it should be used because of its far-ranging effects. But there are always a range in which the medical practice works, and that's why when a court is adjudicating, they always look at the standard of care or a reasonable standard of care, and also the intent. So there is no intent to harm, and you're following the reasonable care during your prescription, and you educate the family appropriately. So if these measures are met, the doctor should not be liable for such cases. It's very unfortunate, and obviously different states have issued statements about cough syrups not to be used in children. That's a welcome move. Rational practice indicates that cough management should be with minimal support medication wise. It's more symptomatic treatment, keeping the patient well hydrated, making sure the ambient airflow is good and humidified if possible, and we have sips of water to suppress the cough. So cough is basically irritation of the receptors in the airway, and if you reduce the irritation, for example, if the nose is blocked, the child is mouth breathing, the dry air is going to irritate the cough receptors in the back of the throat and in the airway, because the humidifying function of the nose is lost in that case. So we take measures to improve nose breathing and reduce mouth breathing. So this is the crux. And obviously we don't want to use cough suppressants because the secretions need to be cleared by the airway as a protective mechanism. So if that is not done appropriately, we may end up in trouble and the underlying condition may worsen as well. If there is reactive airway disease, either due to the viral infection, we call it viral related wheeze in kids, or due to asthma, we can give bronchodilator treatment, but the regular use of bronchodilators should be discouraged. Nebulized saline is useful in some cases of bronchiolitis in young kids because their airway is very narrow and it gets further narrowed by the swelling of the airway wall. So I've discussed all these in separate videos and I can share the links with you. So this is just an update to the earlier video, and I hope this information is useful. I hope the doctor gets released. The Indian Academy, the IMA and many other colleagues are working towards clearing the doctor's name. And this is a lesson for all of us. Please only prescribe what is needed and from trustable brands as far as possible. Make sure the patient understands when it's a symptomatic treatment that they don't need to give a course. They don't keep giving the medicine for 5 days. They just give it based on the symptoms. So as part of your routine, make sure you explain to them that symptomatic treatment is for these symptoms, and if this symptom doesn't exist, you don't give. So no paracetamol if no pain or fever, and even that you can grade it by saying mild fever you can observe without the medication. And if there is a nose block, you advise a saline spray predominantly. Older kids, you may use a decongestant spray for a brief time for the same reason I explained. Homemade remedies, lemon and honey above 1 year of age, lukewarm water to keep sipping, avoiding mouth breathing, so a semi-recommend position to sleep, all these would help as well. So do share your thoughts, and I appreciate your watching this. Thank you.